Today's discussion about blood test spots multiple cancers without clear symptoms. Dr. Hale, new era for cancer screening as major research shows effectiveness of Galleri test. Specialists have advised wellbeing administrations to get ready for another time of disease screening after a review found a straightforward blood test could recognize different malignant growth types in patients before they foster clear side effects. The Pathfinder concentraton offered the blood test to in excess of 6,600 grown-ups, matured 50 and over, and distinguished many new instances of sickness. Numerous tumors were at a beginning phase, and almost 3 to 4 were structures not regularly evaluated for. It is the initial time results from the Galleri test, which searches for disease DNA in the blood, have been gotten back to patients and their PCPs to direct malignant growth examinations and any essential treatment. The Galleri test has been portrayed as a potential game changer by NHS Britain, which is because of report results from a significant preliminary affecting 165,000 individuals 1 year from now. Specialists trust the test will save lives by recognizing disease early enough for medical procedure and therapy to be more viable. Yet the innovation is still being developed. I believe what's thrilling about this new world view and idea is that large numbers of these were malignant growths for which we have no standard screening. Dr. Dave Strack, a senior scientist on the review at the Dedication Sloan Kettering Disease Center in New York, told the European Culture for Clinical Oncology meeting in Paris on Sunday. In the Pathfinder review, 6,621 grown-ups, matured 50 and over, were offered the Galleri blood test. For 6,529 workers, the test was negative, yet it hailed a likely malignant growth in 92. Further tests affirmed strong growths or blood disease in 35 individuals, or 1.4% of the review bunch. The test seen two malignant growths in a lady who had bosom and endometrial cancers. First recognizing the presence of sickness, the test predicts where the malignant growth is, permitting specialists to quick track the subsequent work expected to find and affirm a disease. The sign of beginning was exceptionally useful in coordinating the sort of workup, said Strack. At the point when the blood test was positive, it ordinarily required under 90 days to get the workups finished. The test recognized 19 strong growths in tissue like the bosom, liver, lung, and colon. However, it likewise spotted ovarian and pancreatic diseases, which are ordinarily distinguished at a late stage and have unfortunate endurance rates. The excess cases were blood malignant growths. Out of the 36 malignant growths identified altogether, 14 were beginning phase and 26 were types of the infection not regularly evaluated for. Further investigations found the blood test was pessimistic for 99.1% of the individuals who were malignant growth free, meaning just a little extent of sound individuals wrongly got a positive outcome. Around 38% of the people who had a positive test ended up having disease. Strack said the test was not yet prepared for populace-wide screening and that individuals should go on with standard malignant growth screening while the innovation is moved along. Be that as it may, this actually proposes a brief look at what the future might hold with an actually quite unique way to deal with malignant growth screening, she said. Fabrice Andre, the head of examination at Gustave Roussy Disease Focus in Legio France, said, inside the following 5 years, we will require more specialists and medical caretakers, along with more analytic and therapy foundation to really focus on the rising number of individuals who will be recognized by multi-malignant growth or recognition tests. Nasser Dravi, the head of proof and execution at Malignant Growth Exploration UK, said blood tests for numerous sorts of diseases used to have a place in the domain of sci-fi. However, presently they are an area of malignant growth research that is showing grant for patients. Research like this is essential for gaining ground against late-stage tumors and allowing more patients the opportunity of a decent result. The Pathfinder preliminary outcomes proves us with a superior comprehension of how much of the time malignant growth is found by the blood test in individuals who haven't been recently analyzed. Yet, we will require information from bigger examinations to completely evaluate this test and other comparative tests being developed, particularly to comprehend whether individuals really get by for longer after their malignant growth is gotten. We have a little blessings to inquiry. Millions are going to the gatekeeper for open, autonomous, quality news consistently, and per users in 180 nations all over the planet currently support us monetarily. We accept everybody merits admittance to data that is grounded in science and truth and examination established in power and honesty. That is the reason we pursue an alternate decision to keep our revealing open for all users, paying little mind to where they live or what they can stand to pay. This implies more individuals can be better educated, joined together, and roused to make a significant move. In these hazardous times, a reality looking for worldwide news association like the Watchman is fundamental. We have no investors or tycoon proprietor, meaning our news coverage is liberated from business and political impact. This makes us unique at the point when it's never been more significant. Our freedom permits us to valiantly research, challenge, and uncover people with great influence. Thank you very much. Please subscribe the channel and stay connected. Bye from this moment.